Hi, my name is Cindy, and today we're going to work on some hip stretches, hip flexor stretches, hamstrings, little low back, and I'm here with two helpers. This is Livy. She is about 12, got her when she was 1. She's adopted, or rescued as they like to say. And then this guy in the front here, this little black bum, is Otis. We got him when he was 9, and he's just turned 11. So they're our old dogs, so they may get in the way. They do what they want to do. I recommend you have 2 blocks and a cloth strap. If you do not have a cloth strap, you can use a hand towel or beach towel, and that works as well. A mat is helpful. A yoga mat, which is a sticky mat, is also helpful for not sliding. If you need to pause to get those items, I would do so. And then join me when you're ready. The very first thing we're going to do is start in a wide knee child's pose. So come onto your hands and knees. Once you're on your hands and knees, bring your knees wide. Bring your toes together and then gently sit your hips back on your heels with your arms extended. Reach as far forward as you can. Bring your forehead to the floor. Hold that position even though I'm going to get up so I can talk without you hearing my muffled voice into the mat. If this is too much for your knees, you're going to bring your hips up slightly, walking your fingers forward to get a more comfortable position. And then hold that instead. And then while you're in this position with your forehead resting, you're going to go and focus on your breath. So just big inhale through the nose, big exhale through the nose. If you have any allergies or seasonal allergies rather, you're going to want to use your mouth a little, but you want to try to breathe through your nose as much as you can comfortably. You're here for about 2 more breaths. Nice full deep breaths. And then you're going to gently press yourself up into table position. So you're going to bring your knees in underneath your hips and your hands are underneath your shoulders. You're going to press away from the mat and start your cat-cow. So inhale, allow your belly to drop as your gaze goes forward. When you exhale, I want you to round through your upper back and let your head hang heavy. You're moving with the pace of your inhale and exhale. So you may not be synchronized with me, you may be faster or even slower. As long as you're moving with your full breath, you're good. Wherever you are in your path, I want you to do a full inhale and exhale. And when you're done with your exhale, I want you to hold your neutral spine. From your neutral spine, I want you to lift up onto your knees. If you need any additional support underneath your knees, you can double up your mat. You can get a second mat, or you can get that towel you might have just grabbed. First thing I want you to do is I want you to bring your right leg forward. And yes, I am on opposite sides. So even though my left leg is forward, I'm going to call it as right. So this is your right leg coming forward. That's just a habit as an instructor. And then I want you to shift forward into that low lunge. In this low lunge position, I want your knee on top of, if not slightly behind your heel. Your back knee is behind your hip. I want you to put your hand on your knee and inhale, lengthen your spine. As you lift up nice and tall, decompressing the spine, I want you to sink a little further forward and lower. Your core is engaged to maintain that alignment and support to the low back. You can reach your opposite arm up into the sky. That is going to help you get deeper through that hip flexor. And then reach over the body, over the bent leg. And that should further the stretch even more. Gently come back up to the center. And I want you to bring your hands down to the floor. If you need blocks, by all means, put them by the sides of your mat and then hold on to the blocks. You're going to shift back. Allow the heel to stay in place and the toes to lift. You're going to soften the knee so it has a little bend or a lot of a bend, and then you're going to square your hips. Now most of us, our hips naturally are going to be shooting off to the diagonal because this is a very comfortable space. I want you to pull your hip back, your right hip back and your left hip forward so that you are squared to the front of the room. It could be to me, to the camera if you're facing straight on, or to the side of the room if you're sideways like I am. Lift your chest nice and tall. Pull the right hip back, left hip forward. Super important that your spine is straight. If we are rounded through our upper back, we go into this posterior pelvic tilt, and we want to create a neutral hip, neutral aligned spine. You know you're doing it because the back of your hamstring is getting a nice stretch. One more breath here. And then we're going to gently shift forward. Before you let go of your blocks, engage your core. Once your core is engaged, bring the hand to your knee, pressing to help lift the torso, decompressing the spine, belly engaged, shift forward, reach your opposite arm to the sky. Reach over the body once again. And then gently come down. Bring your hands to blocks or the floor. If you can keep your back straight, you don't need blocks. Heel down, toe comes up. Slightly bend that extended leg. So you do not want to lock out. Most of the time we lock out, we go into this posterior pelvic tilt, this rounded position. When we keep a little bend in the knee, we keep that neutral hip. Pull the right hip back, left hip forward, and then we can come down. So if you can keep a straight back, you can come to the floor. Once you have to round to get there, the whole body moves. So blocks allow you to get into positions better. The alignment stays stronger. A lot of people use blocks or think of blocks as crutches. That means you can't do something and you're failing. That is wrong, because often if you compensate, that's the fail, right? So using the blocks actually gets you better into that position. All right, that was our last one on this side. We're going to bring that right leg back, and we're going to sit in our heels, hips on heels. So this is a little stretch for that quad. If this is a little too much, you can sit on a block flat or high, and what that does is takes the weight up onto the block and up off the knee. So if you don't quite have the stretch on your quads, the top of your thighs, it just takes a little time, and but be nice to your knees. Your knees don't need to be forced into something they're not ready for. All right, I like to move the blocks forward so they're ready. Come up onto your knees once again, and we're going to switch to the left leg. Yes, I know I'm opposite. I'm just used to teaching that way. So once your leg's extended, you're going to engage your core, lift up nice and tall, and shift forward. Same thing's happening. Your knee is on top of, if not slightly behind your heel. Your hip is shifted forward over that back knee. How much flexibility you have in your hip flexor is going to determine how far forward you can actually go. Your core is engaged. Hand on the knee, inhale, lift up, reach the opposite hand to the sky. We want that decompression, that lift through the torso. And then reach the arm over the body to deepen that stretch through our right hip flexor. Bring those hands down, bring them to blocks or to the floor. You know what you can do. You just did the other side, and we're going to shift back. Heel down, toe up, walk the hands back, square the hips, pull the left hip back, right hip forward. Lift nice and tall through your spine. Keep that back straight. It's a fairly intense stretch, so if you got pretty deep into it and it's not that intense, there may be a relaxing of the foot, a straightening of the leg, the rounding of the back. When you're in this position, there's not a whole lot going on, or not enough of the right stuff. Pull back. We got one more breath here, and then we're going to walk forward. Engage your core before you let go. Once you let go, the hip's nice and heavy. Hand comes to the knee. Inhale, lift up, create that extension, that decompression by lengthening the spine, and then reach over to get that deeper stretch. And then gently release, come down, and go back into that half split. Ardha Hanumanasana is the name of the pose. We're lifted up nice and tall. We pull the right hip back. Left hip back, right hip forward. Toes are flexed. Knee is gently bent. Back is straight. If you can handle the floor, go for it. It's not that you can't touch the floor, it's that you need to be touching the floor with good form. And then gently release, come back, Vajrasana. We sit back on our heels. Remember, you can sit on blocks, 1 or 2, whatever you need to get that comfortable position. We just like to take a moment to give the body a little break. All right, the next thing we're going to go into is a pigeon pose for the hip, a little deeper stretch. So we did hamstrings and hip flexors, and now we're going to go into our pigeon. Now, one of the problems that I find in pigeon, by the way, you need your blocks close to the top of the mat, is that folks will not be willing to bring their leg to the edge of the mat. So I'm just going to shift over. So what I want you to do is get into a tall plank, lift up into your tall plank, right? And then what I want you to do is I want you to bring your knee up behind your wrist. So my knee is on the outside edge of the mat. And then I want you to take your foot and I want you to bring it to the other hand. Best you can. It's not going to be perfect. Mine's tucked behind here, right? And then you're going to bring the knee to the floor, and that's the more important part. We're going to walk our back leg back to get this deeper stretch on the hip. We're going to gently press that opposite hip down to the ground and come to our forearms. Now, if you cannot come to your forearms, maybe you need blocks. You can come to your forearms on blocks. If that's still too low, bring them up slightly higher. Just be careful going too high because they become unstable. Whatever allows you to have that elongated torso and to square your hips to the floor. So you're going to take that opposite hip and press it down. The top of your foot is flat on the floor. The full leg is engaged. That means my big toe and pinky toe, nails both on both sides, are pressing the floor. My foot's not rotated out, and I actually don't know how people do it the other way, but I've seen it. But a lot of people just kind of relax the foot. You want it nice and engaged. You're going to come down as far as you can onto your forearms. And the reason we're going to forearms is just take a little pressure out of the shoulders. But once you do that, now your neck has to hold your head. If you want to rest your head on a block, I recommend going pretty high up. If you can easily get lower without your head dropping down, do so. So make sure the torso is what's coming down, and then the head would come to a block or your fists. If you can get to the head to the floor and the elbows go wide and your nose and your forehead can touch, that's kind of important, because when you drop the head down and just the top of the head or the hairline touches, you're going into this rounded position, and I'd rather you be a little taller with your head closer to the alignment of your spine. Is there anything wrong with doing it the other way? No, it's just not an ideal safe space, right? We're looking for the optimum safe position for this half pigeon. We'll be here for a couple more breaths. And then I want you to gently press yourself up. And from this position, I want you to lower to your hip. Your leg is bent. I want you to sweep your other leg all the way around. Now this is Janu Shirasanu. I'm going to face you for this one. Janu Shirasanu. Basically, your opposite leg that was behind you is now extended fully in front of you. Should be your left leg. And now your right leg is bent in, and the foot presses very gently to the inside thigh of that extended leg. Straps. You may need it, you may not. What you're going to do is you're going to put the strap on the bony structure of your foot, not the tender arch. So see how it's on the ball of my foot, not down on the arch. The only time you ever want to put a strap on your arch of your foot is if you're in a shoe, because you got that hard plastic supporting it. But you don't want to be pulling on a strap that's on the tender fascia of your foot. So here we are in Janu Shirasanu. We're going to sit up nice and tall, lifted through the spine. We're going to make sure our torso is rotated square with the extended left leg, and then you're just going to gently pull in until you get a stretch in the back of your thigh. How far forward you come is all about the hamstring tightness, right? So when we do a forward fold, it originates at the hip. That's where the fold starts, right? So as you fold forward, the belly would come to the thigh, the chest would come to the knee, and the chin and the face could rest on your shin. You are not doing it in the other direction. So when you come into this position, this is why I go sideways and forwards, is so that you can see from this position, I'm in a lifted spine and I come forward and I have a straight back. What happens is a lot of people are like, nope, I want to look flexible. And they round their body and they're trying to get their head in first. And when you get your head in first, you curl. You can't really see I'm wearing this giant sweatshirt. You curl in and you go into sort of that cat position from cat-cow. And when you do that, you go into a posterior pelvic tilt. You press through your thoracic spine and you round your head, right? So, and everyone does this reaching for their foot, and that's a lot on the back and not enough on the hamstring. So I really want you lifted up tall, so we elongate and decompress the spine, and then I want you to hinge from the hip. Once your belly touches your thigh, your goal is to try to get the chest to touch your knee. And guess what? If they don't ever get there, it doesn't matter. Are you getting hamstring stretch? Hopefully the answer is yes. All right, we're going to gently release up. Put the strap to the side. You won't need it until we get to the other side. But the very next stretch is the left side half pigeon. I like to cross ankles and come over. Come back into your tall plank. In your tall plank position, now we're going to draw the left knee behind the left wrist. Walk the foot over to the other hand best you can. Bring your back knee down and start to walk it back. We want that external rotation on your hip. Press your right hip down and decide, are you up high? Are you on blocks on your forearms? Your forearms making it to the mat. Once you start to bend forward or lengthen into that bent position or decline, incline, however you want to call it, you should support your head. If you're up really high, your block should be high. If your elbows are out and you're low, your block can go lower. If you're all the way down, the elbows are super wide, and you can bring your head to the floor. Again, I caution you that the forehead touches the floor, not the hairline, not the top of the head. That means you're bending the head in. And you want to try to keep as much elongation as possible, and at the same time, pressing that right hip down, and all fingers, not fingers, but toes. Toenails are pressed into the floor. Big toe and pinky toenails pressed down so that you have an aligned hip and leg and you're not relaxed and rolled out. And then find that place to kind of relax and enjoy this really deep stretch. When we get into these really deep stretches and you're really tight, it doesn't make for a very exciting experience. It doesn't even make for a completely pleasant experience. Those who stretch all the time sort of develop a love of the feel of stretching a tight muscle. And when you're really tight and you're just starting, it's just all misery and sadness and tears. So I'm sorry about that. Make sure there's no absolute pain. You don't want to be in pain. That's not the point here. The point is to take that tight muscle and try to lengthen it. And so there is some discomfort in changing the body. That part I can't help you with, other than please don't go into a place of pain. If you're holding your breath because you're pressing so hard, you're too deep into the position. This needs to be a strong stretch, but not so strong that you cannot relax while the stretch takes place. There's that thin line. You have to determine where that line is. I can't determine that for you. I would say that if you're fighting your air, or you're like constantly have to fidget because it hurts, you're probably too deep. If you could fall asleep because it's hardly anything going on, it's too easy. Find that space. Find that space where you know you're getting a stretch and you can hold it, though you hope we don't hold it too long. That's sort of that line I like to sit in, or sit on. We'll be here for one more breath. And then gently press yourself up. We're going to lower to that hip. We're going to swing the right leg around so we can get into our Janu Shirasana on the opposite side. Again, I'm turning to face you. Fit my legs in between the pups. All right, so we're sitting up nice and tall. Now the left leg folds in, presses the foot into the right thigh. Strap or no strap, you decide. You know what you need. You know what you need to have good form. If you're using your strap, it's on the bony structure. Lift up nice and tall. Make sure your torso is squared to that extended right leg. You're not off to the side. It's a different stretch. Also awesome. You may see that in another video. Lift up nice and tall, and you're going to gently pull yourself in. Keep your torso lifted. So important. If you're in a toe hold, you can do same side or opposite side. It's up to you. Lift up, gently pull in. You're still not going to let that torso round. You're still going to stay lifted. Lengthening through the spine with your inhale, trying to get deeper with your exhale, getting the stretch you need. One more breath here. And then gently sit yourself up nice and tall. All right, in this position, what we're going to do is we're going to cross our legs as comfortable as we can get. And we're going to do some spinal twists. So sitting comfortable, super important. If sitting in this position is not comfortable, you can sit on your blocks. If sitting on one is kind of weird, you can put the two together like a nice little bench. You can also sit on your towel that you brought, just kind of roll it up so it's the kind of way that you would put a towel in a closet, right? So just kind of stack it up so it's folded. Sitting up nice and tall, super important that we are lifted. Bring your right hand behind you and your left hand to your right knee. I want you to inhale, lengthen your spine, and then exhale, push on the knee and the floor to press into your twist. Look all the way over your right shoulder. You always want to lengthen before you twist so that you have that decompression through your spine. You get the better and safer twist. And then gently release and come back through. Once you're on the other side, you're going to put your right hand on your left knee. Your left hand goes behind you. It's tenting the fingers when the fingers are down and the palm is up. Inhale, lengthen. Press to twist. Look over your left shoulder. And then gently come to center. Switch the cross of your legs. What we're going to do is we're going to bring our hands down by our sides. Your right hand stays down. If you can go flat, that's fine. If you want to tent, that's fine. Lift your left arm to the sky. I want you to reach as high as you can. Now that you're reaching, press your right hand down. Keep the right hand pressing down as the left hand reaches up. You're going to feel that elongation on the side of your torso. Once you do that, I want you to bend the elbow of your right hand as you fold over. Now that you've folded, you're not going to go any further. Now you're reaching the left arm up and over. Make sure the arm doesn't rotate down in front of your face. Keep it lifted in that lateral fold. And then gently come up. Switch sides. Left hand down, right arm up. Reach nice and long. Reach and then fold. The left hand is there to support, so you're not just dumping into your body. You want to have that elongation. We don't want to create compression. We want to create space. And then come back up. We're going to do the same thing. We're going to add a diagonal. So lift up nice and tall. We're going to fold into that lateral. When we come back up to center, we're going to rotate so that our left shoulder goes over our right knee. So we're going to go at a diagonal over that knee. So we're lifted, and then we're going to reach. So I'm still going to press in the right hand to keep myself pressed up, and I'm going to reach over. Now keep reaching while I demo with my hands. So this space now is where you're going to feel that stretch. It's a tough area to get to. It gets really tight when we sit a lot. Gently come up. We'll switch. Last thing we're going to do. We're going to lift up, fold. We're going to come back up, and then we're going to go at a diagonal. Take that right shoulder over past the left knee. Now, is it really going to go past? Nah, don't worry about that. It's just the concept and idea and expression, just so you get the feel for where you're going. And then gently come up. All right, thank you so very much. This is I like to call it quick, although this might be a long stretch, but this is a very good stretch to do. You can do this daily. You can do it when you feel like you need it, and then maybe a little more than that because you probably need it more. Again, my name is Cindy. This is Fit and Thriving with Cindy. If you're interested in live online classes, I have a Saturday online live class. It's $8. Venmo. You would have to email me to set that up and get invited in. And my email is fitandthrivingpt, as in physical therapy or personal training. And that's